Okay, well, good morning everyone, and welcome to this West London Business webinar on promoting health and well-being in the workplace. We have a punchy agenda for the next hour. I'll be kicking off very briefly with some GoToWebinar essentials. And just giving you a quick tour of how the system works for anyone that's new to the GoToWebinar system. I'll then be handing over to Nathan from the health team at the GLA, who will be introducing us all to the Mayor's Healthy Workplace Charter, which over the past year or so we've been particularly interested in West London Business as an overarching framework for how health and well-being can be addressed in the workplace. Nathan will also zoom in on 2 West London case studies from Olympia, London, as well as Danone. We'll have a brief pause at that point for questions and answers to be taken from everyone that's on the call, and then at 10:30, so that's the first half hour, we'll be looking at some case studies. First of all, from WPA, where we've got Graham Roberts joining us, a healthcare partner at WPA. We'll then turn to Suresh from vDoc, who will introduce their services, and for a third case study and potential tool that you might want to introduce to your workplace, Declan, Corporate Partnerships Manager at Perkbox. Finally, we'll hear from Sarah at Dementia Action Alliance, who will talk particularly about their work in Ealing. And then the last 10 minutes of the webinar will have so that's the agenda for the next hour. As I promised, a quick introduction to GoToWebinar for the uninitiated. You'll see on the GoToWebinar dashboard a little arrow next to chat, and if you click on that, it will expand the chat window, so you can then type in questions which will be shared with everyone else on the call. Feel free to fire questions our way throughout the webinar. We've got Clarence tracking your queries, reflections as they come in, and then we'll take a look at those as we pause at those 2 points during the webinar for your questions. We also have an icon there that you can click on to expand the presentation into full screen view. So if you find there's a cluttered slide that's difficult to see, click on full screen. And just under the full screen icon, there is a raise your hand icon, which again you can use to draw our attention to perhaps any queries that you may have, technical problems, or indeed questions that you've just typed into the chat window and for some reason we haven't spotted. And there's just a reminder at the bottom there with regards to the chat window and exactly where you write your question in or type your question in and then press enter. If I can ask everyone just to raise your hands using that raise your hands button, just to confirm that you can hear us okay.
I can hear you great, Andrew. It's Sarah.
Fantastic.
I'm not on the webinar thing, but I can hear you.
I don't have a hand, Andrew, here, but I can hear you perfectly as well.
Excellent. Lots of confirmation all round. David, I haven't seen a hands up from you, so if you can give us a hands up just to reassure us that you can hear us okay, click on the hands up icon, that would be fantastic. I should also just add at this point that we are recording today's call, so the webinar will be available on YouTube for anyone that hasn't been able to join us and is interested in learning more about these programs. So without further ado, I'm going to hand over to Nathan from the GLA to introduce us to the Healthy Workplace Charter. Over to you, Nathan.
Hi everyone, so I'm Nathan. I work in the health team at the GLA, and I'm going to be talking about the London Healthy Workplace Charter. So essentially, It's a structured framework that businesses can use to benchmark against their health and wellbeing policies. So you've just got a bit of an overview there about what I'm going to cover. So in terms of the first slide, so we all know that working is good for us. Happier workers are 12% more productive than average. Unhappy workers are 10% less productive. Almost 14 million working days are lost to sickness absence in London every year. So I guess the simple fact is if you have a job, then you can expect to live for longer and in better health. It should be good work, which is healthy, safe, offering individuals some influence about how work is done and providing a sense of self-worth. So it's also a good place to offer health promotion, prevention activities and encourage people to take responsibility for their own health and support them to actually make healthy choices for them and in turn influence family, friends around them. So that's just a little bit of an overview in terms of where we're kind of coming from. So in terms of the Mayor's Healthy Workplace Commitment, as I said, we all know work is good for you. It improves your physical and mental health and well-being. The workplace is obviously an ideal place to promote these type of activities. So some of these areas around healthy eating, physical activity, and smoking cessation are all covered within the Charter itself. So, as I mentioned, the Charter, it's an evidence-based accreditation scheme. It supports and inspires employers to create health-enhancing, supportive, productive workplaces where staff can flourish. There are 8 flexible standards, which I'll go through shortly, and we are working in partnership with 26 boroughs, including those in West London, to help deliver the programme. So in terms of our achievements today, we've got, I think it's gone up now actually, so we've got 543 employers signed up. So that's all types of businesses from the public and private sector, small and large. We've got 100 who are actually awarded. So the 3 award levels are commitment, achievement and excellence. And this is covering 290,000 employees actually benefiting from these kind of policies and schemes within workplaces. So breaking that down, you've got 69 large, 73 SME and 8 micro organisations which have got the accreditation. So just a little note around our actual ambitions for the programme. We want to scale up with 750,000 employees benefiting by the end of 2020. So just down to the actual standards that a business would need to cover in order to get the award. So you've got corporate support for wellbeing, and that means leadership for health, planning for health, equality guidance, and the engagement and ownership shown by senior managers in the organisation. Attendance management is ways in which information is used to help managers reduce their sickness absence and inform management about this. Health and safety is pretty self-explanatory. Healthy eating is ways in which the organisation can encourage and enable staff to eat healthier. So physical activity is a way that the organisation actively promotes the importance and benefits of this and creating opportunities for employees to become more involved. Mental health is ways in which the organisation protects and promotes the mental health and well-being of their staff. Alcohol substance misuse is the ways in which the organisation responds to problematic use of alcohol and other substances. And smoking is ways in which the organisation goes beyond the minimum legal requirements for their staff. So you've got the 3 levels of the award here. Commitment level is the kind of bronze level, I guess. Achievement is a silver and excellence is the gold. So in order for your business to apply for a commitment, you can do this online. It's quite straightforward. If you were to go in at achievement level, you could apply, and then what you would be required to attend a verification day where we've got health and wellbeing experts from a variety of professions who would actually discuss with you your application and what you're doing in terms of your actual policy. So the length of time that it can take to achieve the award can vary. It's not something you could probably just go online and do, submit, and then get it back the next day. We would have to probably discuss with you around your needs, the size of your organisation, but all that support is provided by us and by local authorities, as well as the verifiers that I mentioned that would actually interview you on the day of the verification day for the award. So we've just got some examples here of healthy changes that we pulled out from some of the applications that we've received from different businesses. So I'll just sort of touch on 3 of them. There was a hospital that had a long history of lots of people going outside to smoke, and they actually replaced it with a stall where fresh fruit was delivered. There was also a trust that I can think of that actually replaced a similar sort of smoking shelter with a green gym, which is, you've probably seen them in parks. Basically, you know, you can just go in basically and exercise, and they're outdoors. You can use it at any time, and staff have been really engaged with that. Another example from the London Fire Brigade is they providing personal trainers and support for their staff and their managers around physical health, showing them how to cook healthier, providing them with some support around mental health training as well. So obviously can be quite a very stressful job. And then just the final example is a lot of businesses have been providing mental health first aid training, which can be come in a number of guises, and you can train managers up to be more aware of issues in staff around mental health. Staff themselves can be trained to see the signs, the warning signs in other staff, and be more supportive around this kind of area. So that's just some examples there from different businesses. So one kind of case study that we pulled together, which was provided from Anna, who you might hear from in the Q&A, is Olympia. So it's obviously the venue over there, and they've got a commitment level, and they're now working towards achievement. So one of the big things that they've done, as I mentioned, is around mental health and wellbeing training for their managers, and that was provided by Mind in Hammersmith and Fulham. They introduced a health assured confidential helpline for staff. They promote health awareness initiatives such as Time to Talk Day, Stoptober and Dry January via their intranet pages. They run sports days, and they also run regular coffee mornings for employees. They've got around 120 full-time staff and 60 part-time employees, and a large number of contractors coming and going. And they were actually attracted to the Charter as an opportunity to review practices against an established benchmark, which is what the Charter is essentially. And mental health well-being was an area that they identified was something they wanted to develop further. So they were quite keen to take advantage of Hammersmith and Fulham's offer of this subsidised mental health and wellbeing training. And as I mentioned, it gave managers a good awareness of common mental health problems and equip them better in their role to promote good mental wellbeing and support people who are experiencing these kind of problems. So the next case study is Danone, who you probably are aware of, and they worked to the Charter to provide more structure and timescale to their employees. They challenged the way that they'd already done things. They benchmarked their existing policies and practices, and they saw a lot of gaps and weaknesses, and a big part of it was actually rewarding the team around these kind of things. So that's just contact details if you're interested in finding out more. You can go online onto the website, you can register, you can drop us an email and find out more. So thank you very much.
Fantastic. Thank you, Nathan, for that whistle-stop tour of the Charter. I'm sure you could talk for hours, as it's close to your heart, but you certainly stuck to the script that we demanded. I was fascinated by the case study that you cited of getting rid of smoking shelters and replacing them with fruit stalls. Did this mean literally that the smokers were sort of left out in the cold and had nowhere to go but to eat fruit?
I don't actually know where they went, but they probably found somewhere else, but I think it probably just helped to maybe encourage them to maybe not go out smoking as much. I don't know. That's just like,
I'm sure in the depths of a British winter it would have that effect. So I don't know whether we've had any questions come in as yet, but I did see a hand go up from Rosalie. So I've just put your microphone on Rosalie for you to chip in with our first question for Nathan and also Anna, who's joined us from Hammersmith. So over to you, Rosalie.
Yeah, thank you. My first question is, what are the barriers in your experience to improving workplace health?
So what are the barriers in your experience to getting workplace health sort of established?
So I suppose talking about it from the charter, I suppose it's because it does require some work. It does require the organisation to look at their own policies. So it can be more of a thing around this is going to actually take resources over business as usual. So that can be a barrier to actually a business actually really looking in detail at their own kind of health and wellbeing policy, I suppose, would be my answer. Dana, do you want to chip in?
So I'll just add to that businesses often see this as an add-on, something extra, and so I encourage them to see the charter, Healthy Workplace Charter, as a tool to help them achieve what they're already looking to achieve. You know, happy employees and ultimately good business. So this is a tool that can make that process easier because it's a roadmap showing you exactly the types of things you need to look at. So yes, it is a challenge to actually set aside the time, but I think if we help people to see that actually this is something that we want to achieve anyway, that can be a helpful way of looking at it.
So there's a sort of long-term payback that can emerge from perhaps that sometimes early pain.
I suppose you could put it like that. Yeah.
And are there particular sort of quick wins that you've seen companies sort of get going on quite swiftly and sort of get a bit of a feel good from, as then sort of spurred them forward? And it's a question for both you and Nathan, I suppose.
So I think at the heart of the Healthy Workplace Charter is the ethos of involving employees and getting their ideas and their feedback on the workplace. So even just starting that ball rolling, starting those conversations, even that in itself can be quite powerful for boosting morale and yeah, starting the journey. I don't know if you want to add.
Yeah, yeah. I'm sure that does help make a sort of more engaged workplace and an atmosphere.
Yeah.
Let's turn back to Rosalie, because I know you've got a string of questions that have sort of come in.
Yes. The second question is, like Heathrow, would Park Royal benefit from having its own chaplaincy to provide an independent support to employees on the estate?
Wow, that's an interesting and challenging question. So Heathrow has a chaplaincy established to provide, I suppose, broad spiritual support and guidance. I think multi-faith support to staff and indeed customers. Is that an idea that could be replicated elsewhere, for example, Park Royal? Have you come across other companies that have...
In terms of the GLA where I work, we've got like a multi-faith room where if you want to, you can go down and pray if you want to, but it's not necessarily something that I don't think is included in the charter standards. The charter standards are quite holistic, but it wouldn't include necessarily that, but it's not to say that it's not something that could be considered or suggested in terms of the resources that businesses might want to refer to if they think that staff, if there's a requirement or an interest in that, would be my answer.
Interesting, thank you.
When you say chaplaincy, do you mean a person or a service, or the space?
I think at Heathrow it's both space and that additional support of a chaplain or some multi-faith chaplains sort of coming in. but certainly, as I think you've described, Nathan, with the GLA, I've come across some workplaces where it's just a space that has been, I suppose, deemed more realistic, perhaps, in terms of provision that can be put on stream.
Because I have come across workplaces who have an in-house counsellor. That would be where that's deemed sort of a good use of resources, maybe a larger organisation. But what seems to be more common is actually buying in a sort of contract with a helpline where people can call a confidential phone number and get the support that way. And I think there are advantages to that, because obviously it can work for any size of business. You pay per head and it's confidential. People can get face-to-face support if they need it, but if they just need that phone call, then that's there for them. And I think it can be helpful in some cases where people feel that an in-house service would be too close to the workplace, and actually offering an independent service can be seen as perhaps more accessible, particularly when we're thinking about work-related stress and things that may well be originating in the workplace. Those are my thoughts.
My recollection is that this sort of area is an area that WPA's services start to move into. So we may hear a little bit from Graham on that later on. But one more question for us, Rosalie, before we move on.
Okay. Are City Hall signed up to the Healthy Workplace Charter, and if yes, can you give one example of how your staff and leadership bring it to life?
Oh wow, so putting Nathan on the spot with the question as to whether City Hall yourselves have signed up to the Charter, and if so, one example of how you're living the Charter.
Yeah, so we're definitely practicing what we preach. We've got the Excellence Award, and that was gained, I don't know, I think it was about 2-3 years ago. One example of how that we sort of senior management are engaging with staff is there was a big review around the staff survey, improving the response to that, which will then in turn help to show what staff are feeling, what they're interested in, and what they feel is missing. So from the kind of top, I suppose the head of paid service is actually quite involved in the kind of staff engagement events. He will, chivvy people to go to health and wellbeing fair. He will send out messages around lunchtime presentations. There is kind of a real engagement there from that kind of level through to kind of HR across the organisation. So I've been there a long time. And I think that it's definitely made a difference in terms of that side of it, because you feel like your employers and the senior members of staff actually do care a lot more, and there's less focus on let's get the job done, as well as like how are you feeling today as well. So yeah, it's definitely been a positive thing for us.
Brilliant. Well, thank you very much, Nathan, and also Anna for chipping in with some of your sort of local expertise. I suppose it's worth explaining that there are borough-level contacts. So if you're in a particular borough of North West London or indeed beyond, and you want to know who your local contact is, Nathan is the person to get in touch with, who can then sort of signpost you through to the local level. Now, we're going to move into a series of sort of fairly punchy 5-minute presentations now from a series of our sort of wider partners who've got different elements to contribute, I suppose, to businesses that feel they need extra support in getting the Healthy Workplace Charter into place. And first up, I'm delighted to welcome Graham Roberts, who is a healthcare partner at WPA, to give us a quick tour of your services. Over to you, Graham.
Good morning. Thank you, Andrew. Good morning. I'm Graham Roberts, as Andrew said. I represent a specialist not-for-profit health insurer at WPA. And I'm not going to do a sales pitch on you, but I'm just going to talk a little bit about the realities of the current and future challenges of the NHS. With the help of some graphics and briefly look at how WPA can help with those challenges to protect the employees, business owners and businesses. Now, when you see how brilliantly the NHS responded to the challenges in Manchester on Monday night and the aftermath, you realise how important it is to have a strong NHS service. You may think it's slightly odd that an advisor on private health insurance would stress the importance of having a healthy NHS, but the truth is we have a mixed economy in the UK, with most health services being delivered by the NHS and some by private health. And it may come as a surprise to you that both services happily coexist and are viewed as complementary by most doctors. And as you can see from the chart, all UK governments have continued to invest since the NHS's formation in 1948, and it's estimated we'll soon be spending 150 billion on the NHS in the UK. And the NHS continues to take a greater slice out of the growing public services budget, so it's now nudging 30%. So why is there so much concern that you see in the press about the NHS performance and talk of the NHS being in crisis? Well, fundamentally our expectations for the NHS is rising more quickly than the NHS budgets will allow. And another reason, thank you Andrew, is improved diet, less smoking, the success of the health services themselves in allowing us to survive illnesses that used to kill us more quickly means we're all living longer, and happily it looks like that trend will continue. I remember as a boy receiving a congratulatory message from the Queen on reaching 100 years of age was a big thing, but if she's writing those messages now, she must be suffering from RSI. Unfortunately, the fact is we are all living longer puts immense pressure on the NHS, and as you can see from the increasing costs of healthcare with age on the chart there. As a simple example, very simple example, 30 years ago, someone with a joint problem and having difficulty walking would be given a walking stick, and these days there's an expectation for a hip or a knee replacement costing between £12,000 and £15,000, whether you have it delivered on the NHS or privately. So the NHS's financial resources are being stretched to breaking point, and you'll see this in most of the press. I mean, it's almost every day or every week. And 2/3 of the NHS trusts are now unfortunately in deficit. As an example of, and there's a number of factors that exacerbate the situation I've listed on the right hand side there. If I haven't got the time to go through all of them, but as an example of new technology, I read last week that the new proton beam cancer therapy centre, which is soon to open in South Wales, will have cost £100 million to install, and it will be able to treat around about 500 patients a year. So if you do the math on that, you can imagine what the treatment costs are. So there's not nearly enough money to fulfil ever-growing public expectations, as you can see. In fact, I read, not listing, I'm not going to go through the list of recent media coverage on there. I believe there was a recent leaked document that revealed the number of NHS patients waiting longer than 18 weeks for routine operations such as hip, knee and cataract surgery could more than double in 2 years after the NHS England removed the target for that 18-week target in their latest report review. Thank you. And as a result of all this, possibly because of the press and the greater visibility, public confidence in the future of NHS performance is lessening, with 57% of people thinking that the situation is going to get worse. Now, as a result, I'm seeing more individuals and companies taking out health cover as the realization grows that we're all probably going to have to take more responsibility for our own healthcare. And maybe you can see some of the aspects of what's been announced recently by a certain party about care in just general care, and having to contribute more of your own money sort of adds weight to that. So the question is, how do we ensure that we receive the care we deserve? And I always come back when I hear the word deserve, I always think of the L'Oreal advert. L'Oreal thinks it's nice that you deserve nice looking hair, but do you not deserve good health even more? And as a little plug here, and who better to choose as your health insurer than WPA? We win lots of awards, and I guess there has to be a reason why we win those awards and have a very high customer retention rate. And here are a few of those. But in summary, we're a true specialist in health cover. That's all we do. That's all I do, and we think we do our job really very, very well. The excellence in services delivered by a team in our head office in Taunton to help you through your claims, and you've got me as your local advisor through the lifetime of the policy. And we think we offer tremendous value for money, especially to business owners, directors and professionals. As one example of what the value we offer, we currently have a partner goes free deal on our individual health insurance policies. If you do the next one, and this is probably the most important plan in terms of the numbers of people that I'm taking on as clients at the moment. I mean, literally hundreds of people are signing up to our NHS top-up cash plan, which provides benefits towards expenses that aren't covered on the NHS, which brings us back full circle. So you still have to pay for glasses and contact lenses and dentistry and therapies and vaccinations and inoculations. And this service provides for those, and it also gives you some access to private services too, like the ability to go and see a private GP if you can't go and see it, or if there's a big queue to see your GP on the NHS, you can also see a private specialist, and the cost of that at the moment is currently less than £5 a month, or from £5 a month per employee. So brilliant. That's a quick run through. Was that about 5 minutes, Andrew?
Thank you very much. You were spot on time there, Graham.
I aim to please, Andrew. I aim to please.
Thank you. Thank you. Now, I think we're going to switch your microphone off, and we're going to pass sort of control or sort of leadership of the presentation now to Suresh, who I'm delighted to welcome from vDoc, both the West London Business member company, but also one of the winners in our annual awards this year, with a particularly innovative product that they've just brought to market. So you're very punchy, Suresh, with I think your 2 slides. So just prompt me when you want me to move on to the second.
Thanks, Andrew. Appreciate that. So just following on from the actual first award that we won, but just to let you know, we actually won a further award, which was the best initiative in terms of health and well-being within HR and law, which is 125 law firms. I'm going to follow up on this because I think what's been really interesting actually hearing from the other 2 speakers is that without a big plug about what we do, ultimately sort of the health and well-being of employees is obviously what's led us to win a couple of awards this year, and it's making it easy to access your GP. Now in the UK, the biggest problem that we've got is actually getting an appointment with our GP, and that's where everything starts. So for an individual, speaking to a doctor, having to go to local surgery, not wanting to take time off work is one of the biggest issues that we face when we go into an organisation. And what's interesting is that every organisation that we go into, we win. And we started off with the city, and then we're now international and all that stuff. But the key thing is this. When we go into an organisation, what we realise is that the number of employees that have been saving up conditions. And what I mean by that is that when they first have access to our GP, they basically say, right, I've had this, I've had that, and what about? So effectively, we can see that they haven't taken time off work, they haven't sort of tried to deal with their issues, and it can relate to anything. So what we do as an initiative is rather than having a GP on site, we give employees access to a GP via video link, or through their PC, or through their tablet, or through their phone. And ultimately, this whole thing about the video online doctor, I mean, there's a couple of other companies out there, but we effectively look at the whole pathway. So what we do for the individuals is give them access. For the businesses and how businesses work, and this obviously ties into the conversations that we've had so far, is that what is the employer pays for this service. So just linking into sort of WPA and the other insurance companies out there, we work in line with them, but we effectively are the first call, because in the UK, in order to access a specialist, you need to see your GP. So the key thing is ultimately the time taken off work, and we've heard before that the NHS is under-resourced, and the primary care element, which is obviously the crucial element in terms of the first point of call, is always the difficulty. And then what happens is that ultimately the employee says, look, you know, a bit worried about taking time off work. The average time taken off work to go and see your GP these days is probably half a day, 3 to 4 hours. And that's, you know, that's a calculation that, you know, is not only used by us, it's used by the industry, which ultimately then translates into lost time of work and obviously productivity, which again, things that we've heard before in the initial slides. So the whole initiative of effectively providing a GP in the office without them physically being there is the most important thing. Now, one of the important factors is that 80% of all our first consultations are resolved at the first consult. Now, what that translates into is that only 1 in 5 of us actually need to see our GP face to face. So all the queues and patient waiting areas in a GP surgery can be avoided. Obviously, we help with the avoidance because obviously we're a service offered to employers to say, look, if you pay for if you pay for your employees, this is what you can have. You can have access to a GP or one of our GPs between the hours of 8 and 5. We also provide another 24/7, 365 access, which is this next. Sorry, Andrew, thank you. The next slide. And it's for very sort of in terms of the cost to the employer. It's it's pretty minimal. But we also give the opportunity for the employee to have the ability to take the service on themselves. And what you see and what we've seen is that in terms of the health and well, obviously, having won the award within law was a good thing. Was that effectively it's not only about productivity savings from the employer, but it's also the health and well-being of the employee. Now, more importantly, since June last year, what we've seen is a 20% increase in the referrals that we've had for stress and psychiatric help within the city, which is a huge thing. And we've been able to, when people have access to a doctor and they know it's a safe service and a confidential service, they don't leave it. They effectively want to deal with it quickly. So that's what we do, in terms of our service, and also helping employers provide a service within the company, which effectively looks at the health and well-being of employees.
Brilliant. Thank you so much for that sort of headline introduction. If people want to find out more about vDoc, what's your website address?
So it's vDoc.global. So it's www.vdoc.global, and they can find out more from there.
Brilliant. Thank you. And I'm sure there may be questions for you in the Q&A shortly. Now we're against the clock, so without further ado, I'm going to switch Suresh's microphone off and Declan's microphone on to welcome Declan Redden, who's leader on corporate partnerships at Perkbox, another West London business member doing very exciting things, which I hope will inspire you all as much as it has us.
Many thanks, Andrew, and thanks to all other speakers. It's been very, very interesting thus far. For those of you who aren't aware of Perkbox, we are an employee engagement company. The idea is that it's a very, very holistic view towards employee benefits across 3 pillars, and they're actually well-being pillars. So if you want to move ahead, Andrew. Some interesting stats that we have here that kind of back up what Nathan and Anna were speaking about earlier in the charter, just about the level of engagement with employees at the minute and their general level of wellness. Only 39% of employees are currently engaged, okay, with work, and we'll go on to explain what that actually means in terms of the output for the company as well. So you want to move ahead, Andrew? Thank you. So here you can see some fairly startling statistics about the state of engagement within the UK at the moment. So 23% looking for another job, obviously is a scary statistic. 83% of people going unrecognised at work. Particularly young people with millennials need that constant recognition, and we're expecting the average raise and turnover rates to reach about 18% by 2018. So this is just setting the background really of how this is detrimental to the company and how Perkbox can come in and fix that. So we heard some interesting stats again earlier today about the absenteeism. 14 million days lost in London by sickness this year, as mentioned by Nathan earlier, obviously is quite startling. In terms of recruitment costs from turnover and training costs, and of course the loss of associated profits when you're training new people, can run into significant amounts of money over the year depending on your industry. And these are all CIPD statistics based upon 39% of people being disengaged. So how can we fix that? Well, Perkbox, what we aim to do is to provide basically a well-being platform that will improve your employees' well-being in three main pillars. That's their financial well-being, their emotional well-being, and also then their physical well-being. So it's an all-round employee engagement solution. So what we've noticed is that 37% of fewer sick days taken, employees are 87% less likely to leave, and engaged employees are twice as likely to stay long-term at any particular company. So let's move ahead again, Andrew. So we offer annual savings at about £800, £808 per year. There's about 260 benefits on there at the moment, and the average increase in employee retention is running at 14%. Okay, so that's some of the background industry. Now, how does this actually help the employee? Let's move ahead. We found that some of our case studies, again, within companies, a reduction in staff turnover has reduced from 58% to 14%, 5% to 43% increase in employee referrals. Okay, and return on investment figures there as well, running at almost 4.5%. So there's a massive benefit to not only the staff themselves, but as a company as a whole across these well-being pillars. So the financial side obviously will stretch out the salaries of members of staff. The emotional side offers a built-in reward and recognition tool, so you can recognize members of staff for their hard work. And what's very important here today, of course, is also the physical well-being. Within that, we have things like dental plan, gym memberships, smoking cessation that has been mentioned here before as well, and the full well-being hub whereby you can access all of these benefits. You see here, this is just an example of the Perkbox platform itself. It is branded so that your company, basically we want all of the staff to attribute these benefits to the company, not to Perkbox. So it's fully branded app-based, so your staff can use all of these benefits out on the go 24/7. App-based redemption means that they're able to use these benefits wherever they go, saving a massive amount of money over the year, and obviously that's making their discretionary expenditure to spend on the family but more attainable to them. So there are many companies and sectors that are working with Perkbox, Group AXA, Viva, some of the major retailers across all spectrums. Go ahead. So financial well-being, as we mentioned, there's a vast array of benefits in there, anything from mobile phone insurance right down to financial plans, or even savings on routes and aggregated savings over the course of the year within retailers like Tesco, Sainsbury's, Boots. So again, stretching out the salary and a fantastic way to retain staff for the companies themselves. The emotional side of Perkbox, as mentioned again, the reward and recognition platform enables you to give credit to members of staff whenever they've done hard work. And what we envisage as a day in the life of a Perkbox customer, anything from your free coffee in the morning, right down through the day to maybe doing some late night shopping on Amazon at night, and everything in between, you can save a massive amount on that daily shop. Go ahead, Andrew. We can move fairly swiftly through these. We also offer a range of salary sacrifice options. Okay, so again, if you're saving on your childcare costs, bicycles, holiday buy-in sale to make sure that your staff aren't worried about what's coming up in the future, all available and built into the platform. Also within there, the emotional side, again, this is making sure that your staff can be appreciated for the hard work. Giving away badges, we can tailor these badges also to make sure that they represent your own core company values. And you can give out these badges to members of staff online in front of their peers. So there's an element of recognition in front of their peers, which means that the general levels of motivation across the company are going to increase as time goes on. Physical well-being, of course, was the main reason we're speaking today. We have a well-being hub that has thousands of HD videos and anything from yoga, mindfulness, healthy eating. There's also then, as we mentioned earlier, the gym memberships, dental care, health cover within that as well. So there's a vast array of ways to make sure that your staff are fit and healthy, so they're psychologically better off, and also that they're physically better off, so that they take less sick days, reduces absenteeism, and also just generally raises the level of motivation for the company as a whole. So again, we can see here major drops in absenteeism, promotion of well-being hubs, and what that can do for the employees within the company. EAP also was mentioned earlier on today. There was a discussion over confidential helplines. We have, it's an in-house service. Earlier on was mentioned again, too close to the workplace. So we would tend to agree with that. EAP service. So if anyone has any sort of stresses that's creating anxiety, that's leading them to taking more days off work, then again, we have a confidential hotline that they can call anytime to try and alleviate that stress before that turns into taking days off work. But 70%, in fact, 73% engagement we run through the platform, so the usage rates are very healthy. In fact, in multiples of anyone else that's in the market, just to make sure that your return on investment is going to be very significant. And there's a full range of supporting tools and reporting that you can get here. So you'll get the number of licenses, users logged in, their average return on investment over the last number of months, so that the company themselves will know that the well-being that they're giving to the staff is proving with great results. And again, it's all about retention. It's all about making sure that your staff are happy and motivated. And again, we in terms of the rewards that we've had as well, voted last year the best employee benefit company in the UK, which is a fantastic accolade, and we're be more than delighted to help anyone else that comes our way. Anyone wants to reach me, there are some details there, and happy, of course, to take any further questions as they come along.
Brilliant. Thank you so much, Declan. I should add that at the West London Business, as a team, we've just signed up to Perkbox ourselves, and I'm particularly excited about the discount on bills from Monday to Thursday. One of my favourite local restaurants out there on Chiswick High Road. So I'll be making use of it very, very soon. Anyway, I'm going to put you on mute for the time being, Declan, until we get to questions in a moment, and hand over now to Sarah Wilcox, who's joining us today from Ealing Dementia Action Alliance, and is going to give us just a quick overview of what the Action Alliance involves. Welcome, Sarah.
Thank you. Can everyone hear me? Yes.
Yes, we can.
Okay, so the slide is fairly self-explanatory for 1,000 people living in Ealing with dementia. This is how the Dementia Action Alliance seeks to make Ealing a more dementia-friendly borough by signing organisations up to action points. So, for example, hosting a Dementia Friends information session, which is a free 45-minute session about dementia, and supporting fundraising events. We have quarterly meetings where the companies all get together and we discuss any projects that people are doing, any updates on dementia. It's really a networking event for people in the borough. I know that we're a bit behind time, so I'm going to do some very punchy bullet points if that's okay. So, what Nathan was talking about at the beginning is very close to my heart, because one of the reasons I want to get businesses involved in the Alliance is because there are so many working carers now. So the media has termed us the sandwich generation because many of us are raising families whilst working, but are now also caring for elderly relatives who have memory problems or other disabilities. So there are lots of research papers now which demonstrate the pressure that this group is under, and I'll just highlight the Institute, a public policy research paper, Older Women Managing Work and Care, which Harriet Harman launched in August 2013. Anecdotally, work with dementia carer-friendly workplaces is an organisation specifically dedicated to working carers, and they found that, and this was anecdotal, that people who didn't feel they could tell their line manager that they were taking a day off to sort out a problem with an elderly relative would call in sick. And sometimes they would call in sick the next day, and occasionally they would call in sick the next day to make it look genuine. So if we worked in an environment where we felt we could tell our line manager, my mother's had a fall, or my mother's been ringing me 6 times in the night, I've got to drive up to Newcastle to sort this out, they might only take 1 day off work instead of 3. So I don't know if Nathan has heard of the Positive Aging Company, but they've got this very interesting device on their website called the Sleeping Tiger Calculator. And you can put into that calculator the number of people who work for your organisation, and it will calculate how much money you're losing as a business per year due to people taking time off for caring responsibilities. So, for example, if you've got 250 employees, you're losing about 25,000 a year. If you're a big company with more than 10,000 employees, you're losing about $1 million a year. So, one of the ways that I want to support employees is by delivering these dementia information sessions, Dementia Friends. These are free and they can be delivered in the workplace. They're about 45 minutes to an hour, and we just cover the basics of dementia, raise awareness, allow time for questions. I also run a charity called Pathways Through Dementia, which goes a bit more in-depth with seminars. So we talk about how to plan ahead for dementia, talking to people about areas like lasting powers of attorney, paying for care, welfare benefits, and other community care laws which can support people on their dementia journey. So it's free to join the Alliance, and we've got about 18 members at the moment, but we really, really want more businesses involved so that we can help them to support working carers.
Brilliant. Thank you so much, Sarah. And I see from the slide that you've got some fairly significant local companies that are already participating in your quarterly meetings in Ealing.
We do. We've got some really, really good companies, but we really do want more businesses, really. We've got a lot of voluntary organisations, obviously, because they're already supporting people living with dementia or carers. So, yeah, we do. We've got a broad range in terms of voluntary organisations and people like Walpole Park. And we've got a couple of solicitors firms, but we really, really do want some more businesses involved.
And your email address for those that would like to get in touch and get involved?
Sure. So it's Sarah, but without an H. So it's Sarah.Wilcox, Wilcox, at alzheimers.org.uk.
Brilliant. And the website that you mentioned sounded intriguing. It was the Sleeping Tiger?
Yeah, so if you go to the Positive Aging Company, or you can just Google Sleeping Tiger Calculator, they've got that on their website, so people can input the number, of employees that they have. And
I think we're all going to be logging. I think we'll all be logging onto the Sleeping Tiger Calculator to
really
find out how good or not the news is for our respective organisations. Now I'm going to take the mute button off both Declan and Suresh. And also Rosalie, because I've seen a note from Rosalie that we've had a few more questions come in, and I wonder whether we should first of all take a question for Graham, Rosalie.
Yes, the question for Graham is, how does WPA differ from other health insurance options?
Blimey, that's a challenge. The one way we differ is the fact that we are fairly low key in the marketplace, and the reason for that is we don't advertise. It's a not-for-profit organisation. It's been around since Job was a lad, but I guess the best way of describing it is the way we treat our clients. We think we look after our clients really very well, not just at the point of sale, but all the way through. And that's why we have such a good reputation in the marketplace, particularly with consultants and doctors, because they know that their patients are going to be safe and treated well through WPA's insurance.
Thank you. So I suppose they're really critical differentiator that you're not non-profit. That must make a real difference in terms of the organisation's culture and the way that you...
It has a distinct impact. I took a client down to see WPA at Taunton for a customer briefing, and their reaction was incredible. For an organisation that has very low visibility in the marketplace. When they saw the ethics that we abide to, the way we treat our clients, the way that everyone works in the office, that they were, it was a meeting of minds. It was quite a remarkable thing to see, to be honest with you. So not every apple tastes the same, as it were.
Thank you, Rosalie. Do we have a question for Suresh on vDoc's work?
Yes. When the pod has been installed and I've had my virtual GP appointment and they've raised a prescription, how does the prescription then reach me so I can go to a pharmacy as soon as possible?
So what happens is you'll tell us where is your closest pharmacy, and we will fax the prescription to that pharmacy. So what happens at the moment, you'll be given 3 days worth of medication until they receive the original, which is usually within 24 hours in any case. But that's how it works. That's how it works with most pharmacies. So you tell us your closest pharmacy, we fax it to them and make sure that you can just walk over there. Simple as that.
We've got some alarms going off in the background there, and bells ringing here in Chiswick. It's clearly we're hitting the top of the hour, but before we close, I think one more question, Rosalie. Goodness, lots of strange sounds coming through, but we'll turn, I think, to Rosalie for a question for Declan.
Okay, so 2 key dimensions of Perkbox are happiness and active health. So can you give us your favorite example of benefits in each of these areas?
Sure. Well, let's see. I think in terms of I'll tell you that at least the most popular, there's will be free mobile phone insurance, which obviously would save staff, in the hundreds of pounds, which I think is certainly the most popular, and it's also free. We actually give it away for free. And then in terms of maybe the wellness side, I think the Wellbeing hub that's in Perkbox is fantastic, because although gym memberships are 25% off, it's fantastic. Not everyone, for personal reasons or time constraints, can go to the gym. Whereas if you go onto the Wellbeing hub that we have in there's things like healthy food recipes, anything from yoga, mindfulness, better sleep, right down to strength or flexibility workouts. It's quite interactive as well. I mean, if you could ask how to go about maybe losing a few pounds for a wedding that's coming up, let's say, and they can give you a nutritional course and a workout program that you can follow to help you achieving your goals. So I think that's absolutely fantastic for everyone to use, and you can do that from the privacy of your own home.
Thank you, Declan. Rosalie, do we have a final question? This time for Sarah.
Yes. Are there groups in other parts of Northwest London as well as Ealing?
Yes, there are. So basically, as part of the dementia strategy, the Alzheimer's Society set up Dementia Action Alliances in pretty much every borough across the country. So in every borough there should be a Dementia Action Alliance coordinator like myself. So if you Google Dementia Action Alliance, and then you can go to that website and you can look up all the Dementia Action Alliances that are in London.
Thank you, Rosalie, for those questions that you've been gathering up. Thank you, Sarah, for our final reply of the morning, and indeed all of the panel that have joined us, both here in our office in Chiswick, West London, as well as those of you that have been dialing in from more exotic locations, and sometimes adding to our colourful soundtrack this morning. Thank you to all of the participants, attendees that have joined us on the line this morning. This webinar recording will be available in the next few days on YouTube, and if you'd like to find out the link, then just drop clarence.bretts@westlondon.com an email. Once again, thank you very much.